Good day everyone, and welcome to this video. Today we'll be taking a look at the dual scan protocol for SimPlant. So this is an image right here of a dual scan that we performed and merged together. So as we all know, the dual scan protocol, as its name states, requires two cone beam CT or CT scans. One of the patient, of the denture, and some radio opaque markers, and then the second one of just the denture and the radio opaque markers themselves. So no patient is scanned twice. So here we can see a really interesting image that where we see the patient, we see the radio opaque markers, but we do not see the denture. Now this is the great thing about the dual scan protocol, is that we do not need to duplicate the denture into barium sulfate. And here is the reason. We can use the patient's actual denture, and then when we merge the two scans together, the one with the patient and then the one of the denture alone, as shown right here, we can actually identify now where the prosthesis is, and we can also determine the mucosal thickness, and basically the space between the bone and the outline of the denture. So let's take a little bit of a better look here. Now this scan has been already segmented, so we're able to see not only the bone but the denture itself. So this is what it looks like with the with the 3D objects being placed here. So I can remove the denture scan and I can just put it back in. So now if we take a look at the inside here on the cross section, we can clearly distinguish here that this is the prosthesis, these is the mucosa and the bone. So if we look around, you can see that it's actually very important that there is no air gap between the mucosa and the denture. We can sometimes see there's a little bit of black here, which means that it's not perfectly sitting, but that's okay, that's perfectly acceptable, seeing a little bit of air gaps right here. But over the entire mandible here, we can actually see that it is a well-fitted denture. So we can also, just to give you an example, we've done here a dual scan with both prostheses together. So now let's take a look at the maxilla. This is what it looks like when we activate the denture for the maxilla. And again, it's a very nice, well-fitted denture. We can see here just a tiny bit of air gap, which is not an issue. And what's most important here for the maxilla is that the palate it fits very well, which is what we see. So now let's take a look at the dual scan protocol, and let's dig deep into the details, and let's review a few pitfalls that we can try to avoid. So first off, we have two scans, as we mentioned before. One of the scan is the bone information. It's with the patient, the denture, the radio opaque markers, and a bite registration. The second scan is the prosthetic information, so only the prosthesis and the radio opaque markers. Now a couple of conditions for the prosthetic information: the denture must be metal free, have the desired aesthetics, and fit well. Like I mentioned in the little demo here, we don't want any air gaps between the denture and the soft tissue. This is particularly important when we're doing a soft tissue guide, because the guide won't fit properly if there are some air gaps. So you'll need to realign the denture to make sure that it fits well, it's well seated on the mucosa, and then you'll get a very solid guide. Now let's take a look at denture preparation. First of all, the denture has to be dry. We have to place 6 to 8 markers around the denture, so mostly on the flanges, as you can see here in the nice image, in random spots. And the reason why it needs to be random is that our computer software will be better at positioning or superimposing both scans together if the markers are positioned in a random fashion. So no straight line, let's just place them in at different heights on the prosthesis buccal and lingual. Now, a good little tip here: for the maxilla, you can place 3 or 4 of those markers on the palate. Now, talking about radiopaque markers, those can be glass beads, not metal beads, okay? And there's a product out there that has the glass beads with sticker on them, so there's no need to modify the denture and put in some gutta percha, or to even just stick those glass beads with either some wax or additional materials. So there's a great little product out there that you can use. Now let's take a look at the bite registration preparation. One of the main things that's crucial is that it must be radio translucid, and by that I mean it cannot be seen in the scan, or it can't light up in the scan, such as radiopaque markers. The reason is bite registration, who will be radio opaque, will make it difficult again for the software to merge the two together. The other thing is that the bite registration must not be perforated and must be a little bit thicker. We're talking about 2 to 5 millimeters thick. The reason why we want to have that thickness is that we can use that bite registration afterwards to fixate the guide in place. Now, I'm talking about obviously the mucosa supported guide. So when you're positioning the guide, we will keep some teeth on the guide so that you can use the bite registration to position the guide in the exact position that the patient was scanned in, so that you're minimizing some errors here. Obviously, because it's a mucosa supported guide, the guide can move, and therefore if we're following the protocol and we're using the bite registration, there should be no problems. So taking a look at the 2 scans, first let's do the scan of the prosthesis, and the reason that is if you're using those radio opaque markers with the little stickers on them, sometimes if the patient has a lot of saliva, there's a risk that those beads might get unstuck from the prosthesis. So in order to circumvent that, do the dual scan protocol using the first scan of the prosthesis first. And this is what it should look like right here. So you get a nice clear definition of the prosthesis. You can see the radio opaque markers right there all throughout the prosthesis. Now if you want to enhance the contrast between the acrylic and the radio opaque beads, you can use the pediatric setting in your cone beam. Then once you've done that first scan, now it's time to scan the patient with the prosthesis and the bite registration. And this is a great example of how it should look like. And we've already seen that as well in the little demo at the beginning of this video. Now let's take a look at some potential pitfalls here. Those are the most common pitfalls that can happen. So this is a great example of a normal scan. This is what you should see for the prosthesis. You shouldn't see anything but the shape outline of the prosthesis and the beads. Now, it is recommended that when we do the scan of the prosthesis, we need to put it up on a piece of foam. Okay, so it can be just a thick piece of foam that you put on the base plate and then you put on your prosthesis. Now, if you don't do that, this can happen right here. So we have the base plate, and the base plate unfortunately is radio opaque. So what happens? Well, if we use that in that sense, we're going to cut off those teeth, okay? Or sometimes that scan is not usable. So you have to be really sure that we elevate that prosthesis above the base plate using a radiolucid material. And like I suggest, a piece of foam does a perfect job. Now, taking a look at more specifically on a Sirona CBCT machine, what can happen here is that there's just not enough contrast between the prosthesis and the surrounding air. And so this has been an issue for quite some time. However, Sirona came up with this cylinder here that you need to use when you're performing the scan, and this should dramatically increase the contrast, and we're not going to have any issues after that. So for those of you who use a Sirona cone beam CT scan, please purchase this specific cylinder to perform the dual scan protocol. I believe it's around $200. So this ends our little video. I hope you've enjoyed it. If you have any more questions, please don't hesitate to contact SimPlant or myself. My name is Luc Charon. I am your Canadian SimPlant representative for Eastern Canada. Have a nice day.